I am Dr. Mamatha B. Shetty, consultant, obstetrician and gynecologist, Cloudnine Hospital, Thanisandra, Bangalore. Checking for cervical dilatation at home is not a very good idea because it increases the chances of infection and also premature rupture of membranes. So usually cervical dilatation is checked only by a health provider or by a doctor. So what are the symptoms we notice is, see, pelvic pressure. As the cervix gets dilated, as the head comes down, it produces pressure on the pelvis, and sometimes they start feeling that bearing down sensation. So that time also that means dilated. And one more is they can be increasing in the contractions. So because of the increased contractions, you can have that pelvic pressure. And one more is loss of mucus plug. When there is release of mucus plug from the cervix, that time also cervical dilatation can occur. So cervical dilatation depends on person to person and contractions also. When the contractions are mild, then the dilatation is delayed. If the contractions are more, if you are getting good contraction, then the cervix dilate faster. But first up to 3 to 4 centimeter of dilatation, the cervical dilatation is slow, which is called latent phase of labor. Many a times this latent phase of labor can be 1 day also 2 day also. Whereas active phase of labor, they dilate very fast once they enter the active phase of labor. The active phase of labor is different in primigravida and multi. In primigravida, active phase of labor is 1 centimeter per hour. Whereas in multigravida, it can dilate faster like half centimeter per hour. When the cervix is dilated up to 10 centimeter, then only we call it as fully dilated. The speed of the dilatation depends upon the number of contractions, position of the baby, and whether it's a first pregnancy or a second pregnancy. Depending upon that, the cervical dilatation occurs.